He's worked in the area of energy research and has a special interest also in electron transport phenomena, where he worked with the Wayne University. I'm also very happy to share with you a program which is very close to Mr. Ramaswamy's heart. He not only inspires people at work, but has created a program called Inspire, where over 10,000 young children have been exposed to some of the leading people across the country and the world, inspiring them to be greater citizens and greater global citizens. So, Mr. Ramaswamy, we look forward to hearing your views. I think the area that you're speaking about of how you can transform healthcare using technology is something which is most topical for us. Thank you for almost giving us the theme address.
Thank you. It's a wonderful opportunity, and I thank the organizers, particularly Apollo, for having given me an opportunity talking to you, although from a distance. A conference on IT should use IT, I suppose, and this has been made possible today by an IT link. I originate from Chennai, and therefore I have a large emotional connect to the doctors in Apollo and Apollo healthcare system itself. The Ministry of Science and Technology includes creation of scientists and development of technology tools. When you talk about technology tools, you ask the question, for what? That's a question that one has to ask. On today's technology, all along I have been initiated into the study of chemistry. We talk about transformation and transitions in two different contexts. When I talk about transition, it takes place suddenly and abruptly. But transformation takes place over a period of time. But transformation truly relates to a permanent change of what we call. Am I back?
Yes, sir. I'm sorry.
Okay, not at all. Well, I guess technology has its boundaries. I was talking about the differences between transition and transformation. Transformation usually relates to what we call a permanent change of states. That is, from one level of healthcare availability to another level of healthcare availability. Whenever we discuss about the transformation of healthcare, three different aspects come to my mind. One is availability of healthcare systems. Second is access to the healthcare system. And the third, a solution to an individual patient or a human being. Should a healthcare system become available, we need to ask in what number and what percentage of the population should it become available. In the national, we have, of course, a large population base. There is this question of primary health care, and there's a question of secondary and the tertiary. It is very difficult to mobilize a population of 1.2 billion people to limited centers of healthcare facilities. So we have to reach the healthcare system to people rather than move the people towards the healthcare facilities. So the availability in this particular context, at least in national perspective that India is positioned today, is to reach the healthcare system. Is it 30%, 50%, 100%? That's a question. Ideally, at national level, we want to have the 100% of the population being able to avail the healthcare facilities in the country. Unfortunately, the number of healthcare professionals in this country would not be sufficient enough to meet a large population base that we have. And I believe the role of science and technology in this particular instance is to ensure through the telemedicine, and IT-related technologies make their systems of medical health care system available to as many people as possible. And we need to reach nearly more than 50% of the population today, which do not seem to have the kind of access and availability to the facilities that we require. That's a challenge. The medical professionals that I know of in this country often tell me that the time lag between the best of medical care systems in the rest of the world and what is available in this country is now a few months difference. But that facility is not available, perhaps, to a very large population base. And that's where the role of the IT and the science and technology systems play a part. We ourselves, from the Department of Science and Technology, have been partnering with many healthcare facilities in this country, the hospitals in this country, in the use of IT and telemedicine concepts and even practices, even provide some support to pilot facilities in this process. We also recognize that present-day healthcare system has become very strongly reliant on large number of biomedical devices, instrumentation and technology. That would require the transformational change relates to the access. And I believe all the available medical systems, healthcare systems, is not necessarily accessible to a very large population base. And in this access, we need to connect healthcare professionals residing in far-off locations. Oftentimes, interconnecting competencies becomes very important when you have the percentage of healthcare professionals required for providing availability and access to a larger population is not commensurate with the population size that we have. In this access to healthcare systems and the transformational changes that one attempts is again the use of just not IT but many other technology tools. Fortunately, in this country, the mobile platform has reached a very large population base. We have close to 900 million mobiles today. The question that we have ahead of us, can we use mobile health as a delivery system, mobile health as a kind of a healthcare to increase the access by using healthcare management systems on the mobile platform? That would need new mobile technology transformations and necessarily, of course, the kinds of interface between. Okay. We are back again, and I guess we continue to experiment on our access between ourselves, between you and us, and that's good news is that we have been able to regain the access again. The most important part that of the focus of healthcare system providing especially a transformational change is making the healthcare system more affordable. Affordability of healthcare system is probably as important as availability and access itself. In this particular case, what the Ministry of Science and Technology and perhaps many other health-related governmental processes would need to focus on use of technology and innovations to drive the cost down. Today, when you talk about a treatment process, if it is outside the purchase that we are not able to deliver, that is an issue. In many other social contexts, there's an insurance system, there are other socio-economic base on which treatment is done. In a country like India, at national level, the very large percentage of the healthcare costs is met by the family. Therefore, it is necessary to bring innovations and technology to make this whole process affordable. In this, we have some opportunity as a country because the expertise cost of India is relatively affordable. And there's some residual idealism in this country long after Mahatma Gandhi's own lifetime. It is possible today to connect healthcare professionals, healthcare engineers and technologists and create innovations which are more affordable in this area. Therefore, what we see in the present context, at the national level at least, by building partnerships across the academy, research, industry, and public-private partnerships, it should be possible to bring about a transformational change in the healthcare system in which science and technology could play a part. It was mentioned to you earlier that the Department of Science and Technology in fact mounted a program called Innovation in Science Pursuit for Inspired Research, which is abbreviated as INSPIRE. That INSPIRE itself was focused on bringing about transformational change in the SNT system in this country. For the benefit of the audience, I'd like to mention